Hello, my name is Judy Gavigan, and my team and I at Wheaton Franciscan Healthcare work with employers in Southeast Wisconsin to help them implement their wellness initiatives. We are very excited to partner with the Greater Milwaukee Association of Realtors in bringing some screenings to you. First, I'd like to share a couple of basic information facts about healthcare that you may already know. First, the cost of healthcare is increasing day after day. And we know that the cost, of course, affects us because it's more money out of our pockets to obtain. And second, lack of exercise, poor eating habits, and smoking attribute to 80% of heart disease and stroke. And then lastly, healthy behaviors lead to less disease, resulting in lower healthcare costs. National statistics indicate that for every 100 employees, there are a number of health risks that are going to affect us. Just to highlight a few, 27 of 100 will have heart disease, 50 will have high cholesterol, and 25 will have high blood pressure. So chances are very likely that we may have a few or more of these risks during our lifetime. So why is wellness important for you and your family? Understanding your health risks will not only benefit you, but it will also benefit your children. Let me give you an example. In my family, both of my parents have had colon cancer. So what that means for me and my siblings is that instead of having our initial baseline test at age 50, we need to do it at age 40. And again, this is understanding the health risks that our family members have, and knowing that history will help you to prepare and plan ahead. Another reason wellness is important is because it can actually save you money, but most importantly, understanding your health risks and being well will also save your life. We are bringing the screening to you to make understanding your health risks even easier. By participating in a health risk assessment, you will get a snapshot of your overall health. The health assessment is a tool to make you aware of your individual health risks. These assessments are completely confidential. Reports are discussed only with you, and once your assessment is done, that information is considered to be a medical record of Wheaton Franciscan Healthcare. Again, these assessments are completely confidential. Okay, here's how it will work. You will be asked to sign up for a specific time that will work best for you on the morning of December 2nd or December 9th. You'll receive an individual questionnaire that you will want to complete for the exception of the last page, and the nurse will complete the biometrics for the last page, and they will include your cholesterol, which is your HDL and your LDL, and your triglycerides, and your glucose. They'll also be screening for your body mass index and your blood pressure. To ensure accurate results for your screenings, please abstain from alcohol for 72 hours and abstain from eating 14 hours prior to your screening time. Once your assessment is processed, it will be mailed directly to you at your home address along with the original questionnaire. You will see a sample of what your report will look like on the screen. And please note that the higher your score, the lower your health risk. The Greater Milwaukee Association of Realtors, partnering with Wheaton Franciscan Healthcare, is able to provide you this great benefit at a cost of $55 for your individual health assessment and the one-on-one consultation with a registered nurse. Normally, these screenings and this consultation would cost you over $300. At the time of your screening, you can simply sign up for your one-on-one consultation with the registered nurse, who will connect with you for a convenient time that will work in your schedule. She can assist you with things such as weight management, physical activity, hypertension, nutritional counseling, stress management, smoking cessation, and she can also talk to you about self-care and prevention methods. Again, these assessments are being brought to you to help you become aware of your health risks that you might have. The one-on-one consultation will enable you to know what to do once you understand what those health risks are. And then, of course, you'll be given some practical recommendations for lifestyle changes. And a couple things to remember, when we talk about lifestyles, we're talking about things such as exercise. And we know that exercise can add years to your life and life to your years. And exercise can be something as simple as walking. So when you're considering what type of exercise to do, consider what may be something that you most enjoy so that you'll be sure and do it on a regular routine, something that you can do all your life, something that's safe, something that's practical and easy. And other lifestyles are also how we eat. Eating healthy is important. And you see in front of you a slide that will indicate some of the changes over the last 20 years. For example, if you look at how the size of a cheeseburger affects you and the number of calories you intake, 20 years ago, a cheeseburger would have been 333 calories, which today is about 590 calories. And you look at a soda, 20 years ago, at 6.5 ounces, today 20 ounces. And that's 250 calories versus 85 calories 20 years ago. One other lifestyle is smoking. Consider resources like the Wisconsin Quit Line and the American Lung Association to help you stop smoking. And then, of course, wearing your seatbelts and also not drinking and driving. The bottom line for you is that unhealthy behaviors result in health risks, which result in chronic disease, which also result to higher healthcare costs. What's the cost of doing nothing? Your quality of life. If you have any questions about this information that has been brought to you today, please don't hesitate to contact me at judy.gavigan@wfhc.org, and I'd be happy to answer your questions. I hope that you will consider participating in this valuable benefit that's being brought to you. Thank you for listening, and we hope to see you in December.